everyone, greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. Fungal infections or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Ramya N, live from Bangalore, to enlighten us on the topic of antifungal. Dr. Ramya N is a dermatologist, cosmetologist, and trichologist in Bangalore and has an experience of 9 years in this field. She practices at Venkat Charmalai Bangalore, and she completed her MD dermatology as cosmetology from Kempegowda Institute of Medical Sciences, Bangalore. Today, Dr. Ramya N will share her expert views with us on antifungal. First of all, welcome doctor to today's platform. And doctor, our first question for you would be, who is at risk for fungal infections?
Thank you for the introduction. Um, I hope everybody is doing good. And let's start with this antifungal session. And the first question she asked me was, who is at risk for fungal infections? So anybody can get fungal infection. If you are healthy, unhealthy, anybody can get fungal infection because fungus is present in environment and you can come in contact with the fungal spores in any part of the, like, you can breathe in the spores or come in contact of the spores on the surfaces, which is common in all places, like in a place where there is a lot of people moving around. So any people can get fungal infection, but sometimes this will not be a problem only if you have a weakened immunity or there is a environmental conditions which are favorable for fungal growth. Then only you will get an infection from the fungal spores. Otherwise, they're usually present everywhere. So that would answer my question, I guess.
Right. So, doctor, what do antifungals treat?
So antifungals are the group of medications which are used to treat the fungal infections. The fungal infections can be systemic and as well as the superficial fungal infections. So we use different types of antifungals depending upon the extent and the depending upon the extent of fungal infections that you have. We use systemic antifungals to treat systemic fungal infections, topical and as well as systemic antifungals to treat superficial fungal infections.
Right. Doctor, how does these antifungal medication work?
Basically, these antifungal medications act on the fungus, they break the cell wall of the fungus and sometimes inhibit the enzyme that is present in the fungus. And there are various mechanisms and various pathways that each antifungal follows. So, like as I mentioned, some of them will act on the cell wall and they break the cell, and hence a lot of fluid or any once the cell wall is broken, the fungus is dead. So it will act that way, or it can activate or destroy the enzymes that are present in the fungus, and it can kill the funguses. So this is how various antifungals act. So that is about it.
Doctor, how do one take these antifungal medications? What is the procedure?
Okay, so the procedure as such, there's like the prescribed time and dosage will be prescribed by your dermatologist based on what kind of infections, like whether it is superficial or systemic fungal infection. Based on that, you'll be given for either like a once a week treatment, or it can range from once a week treatment to weekly thrice treatment to everyday treatment for 15 to 20 weeks, 15 days to 20 days, or it can go up to 6 weeks to 8 weeks in case of superficial fungal infection, or sometimes longer in case of systemic fungal infection. So you have to take according to what dermatologist has told. And also there are various topical antifungals which has to be applied along in case of superficial fungal infection, which obviously they will ask you to apply twice a day or thrice a day or once a day. Some of the antifungals are used as once a day. There are shampoos, basically shampoo based antifungals, powder based antifungals. So there are various ways, and this is how various antifungals are available. And according to your infection, the doctor advises you to use the antifungals.
Right, right. So, doctor, my next question was, of course, the way, like, how long do you need to take the medications, which you have already answered. But
Yeah.
please let us know what are the most possible areas where one should get affected.
So, like I said, fungus are present everywhere in the environment. You come in contact with the spores here and there, but they usually don't cause infections. They cause infections in places where there is humid or there's a lot of moisture. Example, armpits, or in case of toes, when you're wearing socks or shoes for a long time and you're sweating in that area for a long time. In the groin region or below the breast in case of females, or sari tying area where there is a lot of moisture trapped there, so that is a favorable condition for fungus to grow. So that is the areas usually people are prone to get fungal infections. Any rashes in this area should be checked upon by a dermatologist.
Right, right. So, doctor, as you have mentioned, the groin area for female also, the area remains the same, I believe.
Yes.
So, so we have a tendency, the the vagina, which normally has a tendency of staying wet all the time. So how does a girl try to avoid that? I have been, listening cases on a daily basis regarding this issue recently. So how do a woman do it?
So, when you say it is a vaginal infection or vaginal fungal infection, it means
Mm-hmm.
that it is a candidiasis usually. Vaginal candidiasis is one thing that is causing infections in females. Basically, candidiasis is a normal commensal there. So, commensals are usually present in normal quantity and they are not harmful in any ways. But there are certain times when it becomes harmful. That is when they overgrow. So this happens when they are taking antibiotics, long-term antibiotics, or if there is a reduced immunity, or if there is a wetness there for a very long time, if they're having a lot of heavy bleeding, so there's a lot of wetness in that area. So that is when the yeast, that is the candida fungus overgrows, and that will cause candidiasis, leads to itching, rashes, and discharges and all of that conditions. So the steps to prevent this is like if you're taking an long-term antifungals, there's also, they say to replace it with the probiotics. Probiotics is known to eliminate the the candidal infections, preventing the wetness there by changing the pads frequently if you have fungal infections, and also the other methods like using a tampon which absorbs the moisture and doesn't let the moisture be around that area, and using cotton underwears or boy shorts. All of those are the precautionary measures in case of heavy bleeding if you are facing. So that will prevent the fungal infection over there, and keeping the good general health to increase your immunity, as well as in case of diabetics, eating, keeping your sugar levels under control. All of that will definitely help in cases of vaginal candidiasis.
Right. Also, doctor, is it contagious anyhow?
The ringworm, that is a superficial fungal infection which appears to be in a ring form. Yes, it is contagious. Like if people come in contact, for a long time, you can get fungal infection. Also, it spreads to the clothes. So you should not share your linens, towels, and other the innerwears with other people who has fungal infections. So that can be contagious.
Right. Doctor, what are the potential side effects of antifungals?
So the potential side effects of antifungals are usually it causes systemic side effects mostly. So they can act like they can increase the liver enzymes, or they can affect your kidney function. Or it's usually safe if you're taken for a prescribed amount, like how the dermatologists tell you. Under monitoring, they prescribe you for 6 to 8 weeks, so they're usually safe. But sometimes, yeah, it can affect the liver enzymes and also have effects on kidney. Sometimes people have hair loss, and some kind of rashes can happen if you're allergic to the medications. And loss of appetite, the common ones are loss of appetite, abdominal pain, abdominal discomfort, vomiting. These are the few normal side effects which can be tackled using the other anti-gastric medications or other things.
Right. Also, doctor, we have heard that once a person has a fungal infection, he or she has a tendency of having it again. Is it true somehow?
No, it's not true. Until unless you have treated the infection properly for the prescribed amount of time, you've taken the treatment completely, and also you're following the precautions that is advised by the doctor continuously. Like if you're someone who has tendency, like if you're working in a place where it is humid and everything, and also you're wearing the wet clothes, or those are the things which leads to reinfection. So if you're taking care of those things, you might not get repeated fungal infections. So this is something, it is basically a lifestyle modification that you have to do. And if you're not doing that, probably you will get infection again and again. But in a rare cases, there is some genetic susceptibility that is coming up right now, that some people are genetically predisposed to get fungal infection. Even in such people, environmental measures to prevent fungal infections can work. So they might not get repeated infections.
Right, right. Doctor, and who are the ones who should totally avoid antifungals?
Okay. So the people who should totally avoid for antifungals, sometimes in pregnancy, we tell them to avoid antifungals. We just give topical antifungals, especially in the first trimester of the pregnancy. We generally don't prescribe the antifungals, but later on, if there is a lot of checking the risk and benefit ratio, we do prescribe antifungals sometimes. But pregnancy is one group, younger children below 1 year is one group, and other people who have a lot of liver diseases, cardiac problems, and who are on many drugs which are for heart disease or any liver conditions. Those are the people who should avoid antifungals. Yeah.
Right. Doctor, also please throw some light on antifungal resistance.
So yeah, antifungal resistance has become a burden now for the medical people, because with the antifungal resistance, the basically antifungal resistance is the fungus stopped reacting, or the fungus become resistant to all these antifungals, and they continue to grow even after taking the medications for very long. So that happens because of the modifications in the genes in the fungus, and also if also because of there is a enzyme epigenetics that can happen in the fungus. All of this leads to fungal resistance. So that happens in the general public. That is because if they have used antifungals of lower strength, or not used adequate strength of antifungals, or used it for a very less amount of time, all of this leads to fungal resistance. So to tackle this antifungal resistance, you should use the antifungals for a very prescribed amount of time, and also how it should be used, which the doctor has told you have to continue to use it that way. So that is one way you can prevent the antifungal resistance.
Right, right. Doctor, this is a very general question. Uh, like the initial stage, people usually tend to, misunderstand, or which usually happens, we are not able to identify the actual problem. So in that case, they tend to go or try something different, or maybe some natural remedies, or some home remedies, or some over the counter medications. So how does the initial stage look like? How does one know that it is a fungal infection?
Yeah, that's a very good question, because this has led to people going and buying OTC medications,
Right,
applying
right.
steroids, and treating it with some acids and lead to complications. So
Exactly.
basically, yeah. So what happens is, and the fungal infection happens, like I mentioned, it happens in a places where there is humid, like in the groin area, or below the breast, or in the armpits, or in the in between the toes, or in those areas where you're like sweating a lot and then you notice a rash which is red, which is round in shape, or even if there is no rash, initially it can start as a small rash which would look like a sweat rash or anything like that. Even then, you have to always get it checked by a dermatologist rather than going and buying an antifungal cream or any other cream from the pharmacy and applying it. And also, if you notice any kind of itching in these areas, and there's a lot of discomfort and a smell in that area, so those are the signs of fungal infection that you notice. That is the red rash, itching, and any smelly smell from the particular part. So that are the that those are the signs that you notice for the fungal infection initially. And always don't treat yourself, always go back to a dermatologist, get it checked. We do a small test called as KOH to rule out fungal infection in the initial stages, so that will give us a clear picture whether it is a other kind of a rash or a fungal infection, and accordingly we will be able to treat it.
Right, right. Also, doctor, another generic question. Uh, we know that fungal infection tend, we have already heard a lot many times in this live that it tend to happen in the sweaty areas or the humid areas. So do we suggest using razors or anything like that on in those areas? What do we suggest our patients normally?
Yeah, so razors basically, if you're like in areas in these areas, the because of the hair, you
Hmm.
can have more sweaty unhygienist. So yeah, you can always shave and keep it clean. That is one of the tricks that you can do to prevent fungal infection. But as such, if you razor as well, there is no guarantee that the sweat glands are reduced. But keeping it clean, because fungus tends to grow on the hair as well, so razoring it out in areas of fungal infection is a good thing. But other tricks that can you can do to reduce the sweating in those areas is keeping it clean and drying yourself completely after you take bath, and also wearing a loose cotton hairy clothes. I mean, clothes that can absorb the sweat or moisture, and using not wearing the tight fitting jeans in case you're sitting for a long time. All of that are the tricks that you can use to prevent the fungal
So
infection.
what if doctor, someone is already suffering with one of the symptom and he or she is using the razor? Can it worsen the symptom somehow?
No, it cannot worsen but it can lead to some kind of irritation if you're using it already irritated skin. Basically, fungal
Right.
infection, it releases some of the toxins that can irritate the skin. That is why you have itching and all the irritation. So if you're using a razor on top of it, definitely you will have some kind of irritation. And also, you're using the same razor in other areas, it can lead to spread of infection to the unaffected area. So yeah, in that cases, you have to be careful. If you have already have a rash, then avoid using razor in that area. Yeah, so and you should keep the razor clean and not use the same razor in the unaffected areas. Those are the things that you have to take care.
Right, right, right. That was very helpful for our viewers who are watching us right now. And I can clearly see our viewers are very well interacting today. We have questions coming up from the viewers. We have
Yes.
Kiara Chauhan asking us, what are the main risk factors for developing a fungal infection?
The main risk factors I would say is having a low immunity. Like the fungal, when there is a immunity is not as strong as it should be, sometimes you're more prone to get fungal infections. And other things are you're always wearing, I mean, the environmental factors like you're working in a humid or a hair condition where there is no air circulations, and wearing a tight and very tight fitting clothes. Those are the conditions which predispose you to get fungal infections. So those are the things.
Right. Also, doctor, we have heard that using public toilets can somehow, cause the same. Is it true?
It can, because people who already have fungal infection, if they have used the washroom and the spores are lying around, and you go and come in contact with the spores, you can definitely get fungal infection. It's not like you will surely get it, because the spores you will come in contact with every day. But there are the local immunity, if it is weakened, or in that area you're like always wet in that area, you can get fungal infection in case of these conditions.
Right. So, what do one do if he or she is traveling very frequently? Can they use the products which are available in the market, the sprays which we get to, use before urinating? Can they be used? Are they helpful somehow?
Yeah, I mean, like, yes, they have some sprays which is like antifungal, like antibacterial, antifungal. So you can use, they can be helpful. Also, keeping a barrier sheet, that is, those are also available right now. So those can be helpful as well. And washing yourself immediately after and drying yourself completely is the most economical and easier way to prevent fungal infections. So you wash yourself properly if you've used public toilets, and then dry yourself completely and use the cloths which are no, I mean those clothes which you've used it, don't reuse it without washing it. So those are the conditions which will help you to get prevent you to get fungal infections.
Right, right. Doctor, the next question comes from Pooja Sharma, who asks, what role do healthcare professionals play in educating parents about antifungal treatments?
Okay, I mean, educating parents about antifungal treatment.
Educating parents about antifungal treatments. What role do healthcare professionals play in?
So basically, it is the healthcare professional who prescribe antifungals. So if they are prescribing you antifungals, they will definitely tell you why it is being prescribed, and definitely they should tell you like how long to take and what are the possible side effects and why are they prescribing in first place. Definitely, healthcare professional will always, if they are prescribing you antifungals, they will always tell you what it should be, why it is given, why it should be taken, and why, how long should you take it. And obviously they will educate it, and their role is at most important in such cases.
Right. The next question, doctor, comes from Ria Sathi, who asks, does antifungal resistance develop and what measures are taken to address it?
So yeah, antifungal resistance, as we talked about it already, antifungal resistance develop and it is happening right now. So that is the major problem that we are facing as a everyday practice. And to prevent that, the measures that are taken are using like different kind of antifungals and prescribing antifungal and educating the patient to stick to the duration of the treatment that we have given, and not advising them to not use lower strength of antifungals, giving them a optimum strength and advising them to use it for a optimum time is what we are trying to do. And there are other antifungals, the newer antifungals which we are trying out, and that has helped in preventing the antifungal resistant to preventing from antifungal resistance happening to the already present ones. So that is the thing.
Right. The next question, doctor, asks, what role do antifungal cream play in the treatment of skin fungal infection?
So, the skin fungal infection, basically, in older days, we used to treat it with only topical antifungals, but topical antifungals alone are not effective nowadays. So, we always use topical antifungals with systemic antifungals in case of skin fungal infection. That is, you are talking about dermatophytosis. So, we always give systemic antifungals and topical antifungals. And yes, topical antifungals are more widely used in case of pregnant women or people with other systemic conditions. Then, if there are contraindications for systemic antifungals, topical antifungals are still being used to treat the skin infections.
Right. The next question, doctor, comes from John, who asks, what are the antifungal agents and how do they work?
The antifungal agents are like the few other examples are itraconazole, terbinafine, fluconazole. These are the antifungal oral antifungals that are present. and they act, like I already mentioned, they act by disrupting the fungal cell wall and causing the fungal death. And also they act on the enzymes of the fungus and disrupt that enzyme, and preventing in the biochemical reactions that happens after it. So these are the mechanism how the antifungal acts and kill the funguses.
Right, right. So, doctor, being an Indian from the Indian society, we always tend to look for home remedies, no matter what disease it is. So, are there any? I know this would be the wrong question to ask, but are there any home remedies for antifungals?
No, there is no home remedies, but there are precautions that that can, like, always, to prevent the toe infections. You can come back home, wash your toes properly, dry it in between toes. Those are the things, and keeping the parts dry. These are the remedies that I say would help in preventing fungal infection. Apart from that, nothing else works. Like all those people who have applied toothpaste or garlic or whatever it is, it doesn't work, and it will cause more side effects to the treatment.
Right. So, doctor, hygiene also plays a very vital role according to us. Would you like to throw some light on that? How important is hygiene to be maintained while one is suffering, or they have a tendency of suffering with fungal infection?
Yes, hygiene is very important. So, like, proper hygiene is the utmost important to tackle the fungal infections. So, hygiene, by hygiene we mean in this moist area, preventing moisture, keeping those areas dry is most important. So, how do you do that? Like, as soon as you come out of bath, so you dry yourself completely in those areas, like the armpits, below the breast, in the groin. So, you pat and dry that area dry, and then after that wear loose cottony clothes. Those, that is also a thing. And also do not share your linens, soap, and other innerwears and with other people. So that is one of the hygiene issues. And also wearing slippers in community centers like a swimming pool and gym areas. Also sanitizing your hands and sanitizing the gym equipments after you use or before you use. These are the hygiene, like the tips and tricks that can help preventing the fungal infections.
Right. The next question, doctor, comes from Devopriyo, who asks, can antifungal drugs be used for both tropical and systematic infection?
Yes, for both topical and systemic infection, we use antifungals. For topical, it is topical and systemic infection. For systemic infection, it will be mainly systemic antifungals for a longer duration of treatment. Yeah.
Right. Doctor, also please let us know. We normally tend to ignore antifungal infections at times. We are like, "Arey, chalo, theek ho jayega." But this can be serious, and we know that. What can be the worst case scenario according to your knowledge? What have you seen so far? The worst case scenario of fungal infection.
Oh, yeah, so though it is harmless, it is quite bothersome, and it is a public health concern of right now. The worst case scenario of systemic fungal, like that skin infection you're talking about, it can spread to the whole body. If someone is suffering from reduced immunity or a diabetes, it can spread to the whole of the. It's not just a localized area like in the armpit or in the. It can come to the whole body, and it can also lead to a condition called as like that is the erythroderma. So the entire body, more than 90% of the body, can be having fungal infections, and this leads to, like, on scratching, this leads to secondary bacterial infections and oozing, crusting. These are the serious conditions that we have seen, and can lead to systemic infections as well as we go on. Like the candidiasis can become systemic infection as well if you have reduced immunity. So these are the worst fungal infections that we have seen.
Right. Doctor, also we know that water is the source of life, and with time we tend to, forget drinking water. People have literally stopped drinking water, maybe because the work pressure, or they do not have the proper time or the intake time, whatsoever the reason is. But does drinking less water play any role in fungal infection?
No, there's no link between water intake and the fungal infection, but there is a link between water intake and the skin hydration. When the skin hydration comes down, you're more prone for getting allergies and infections. So that is an indirect relationship, but there's no
Right.
direct relationship. So obviously, to maintain the skin hydration, good skin health, you need to, and also the immunity, you need to drink enough water for anyone.
Right, right. So it's somehow indirectly
Yes.
connected.
Yes.
Right. Well, that was a very, very interesting and informative session with you, Doctor. Before we take a leave today, any take home note for our viewers who are watching us right now?
Yeah, so when it comes to any skin rashes or any itching that you face in the skin, please do not ignore. Come to a dermatologist, get it checked whether it is a fungal infection or an allergy, and then always treat it properly and follow the advices that is given by your doctor. And be safe, and you be maintain the hygienic precautions that we already mentioned, so that way you can protect you and your family from the fungal infection. And also any any questions or any general health that you have, you can go to a dermatologist and ask about it, so that will be helpful.
Right. Well, that's what we always say, that we have our experts around you to help you out in any of your toughest situation. And that was Dr. Ramya N for us. Thank you so much, Doctor, once again for your valuable time. It has been quite an informative session for our viewers, and we look forward to many more such sessions in coming times. And thank you, viewers, for your excellent participation. For more information and update, stay connected on our skin health and care page. Also, stay connected on our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay
Thank
safe
you.
and stay healthy.
Thank you.